of my extremely good friends. He is a brother from another mother, and we fight a lot on these financial streets. Many of the things that you've seen in the Black financial movements, Torrence have actually been behind the scenes on everything from Banking Black to the new My Black Receipt. He has been behind it. He is an innovator with HBCU Wall Street and many things, but I'm not going to steal his thunder. So let me go ahead and introduce Mr. Torrence Reed.
Well, thank you. Thank you, Angel, for the introduction. Happy to be here. Happy to be here. I do know we are on a strict time clock, so I'll get right into it. I'm one of the co-founders of HBCU Wall Street. We teach college students as well as any HBCU stakeholders how to increase their net worth and acquire assets while college students. I'll explain to you a little later the ramifications of that. I'm also the co-founder of HBCU Realty. We actually work to revitalize HBCU neighborhoods through the use of technology and crowdfunding. So when I think of socio-economic health, I think of it from a different lens and a different perspective, right? Racism actually has far-reaching tentacles basically in every factor of socio-economic health, right? Whether that's educational attainment, or financial capabilities, or personal development opportunities, right? You can't not look at the fact that someone who has experienced racism may generationally be in a position where they're not healthy, right? And when I say healthy, I mean you can't have all areas of health minus the financial aspect, right? And for me, I would think that the long-standing institution of racism, basically that has built such a wealth disparity in our country that continues to widen, right? I think what's not talked about is are the mental aspects of that, right? Or the mental health ramifications of never being financially solid, of never being financially grounded, of never being fiscally confident, right? That actually weighs on an individual, right? When you add lack of progress with what internally and externally looks like a system built to prohibit you, right, from generating wealth, right, from attaining as much as you can, and you watch your counterpart who is of a different color achieve those same things, right? And that institution of racism doesn't provide those same impediments. That begins to take a mental toll on you. That begins to take that begins to become a collective social strain, right, on the people as a total, right? And so one of the reasons that we created HBC Wall Street and many of the avenues that I think these solutions lie in are in utilizing HBCUs as they once were, right? Not only are HBCUs historically at the heart of many of these civil movements in this country, they basically served as incubators for the community. And what I mean by that was when the growth and the progression happened on the university, it permeated outward towards the community. And so nowadays, due in part to systematic racism, you have one or two scenarios. That's not that past incubation model. You have the school growing in the middle of the community and the community deteriorating on the outside of it. Or you have the community growing on the outside of the school and the school deteriorating in the middle, right? So not only does this have a fiscal effect and an aesthetic effect, this has a mental effect as well, right? When people don't see the things that they own and they are a part of progressing, and that they don't feel they have ownership in that progression, that is going to affect your attitude, right? your thoughts become your attitude, become your actions, right? And so when people don't see growth and they don't feel growth in their communities, then they won't mentally grow, right? And we all know that the first step to getting to a better fiscal space is a paradigm shift in your mind, right? Wanting to be in a better space, wanting to seek out opportunities, wanting to seek out initiatives and campaigns and organizations and things of the such that can help you, right? Pull yourself out of this dredged financial mental space that oftentimes looks like has been created for you, right? And so I think, as I stated, right, I think a real solution is for the HBCUs to return to a state of incubation, right? And when I say incubation, I mean technology, right? An HBCU campus is a breeding ground for test users. An HBCU campus is a breeding ground as a young student to mess up or to learn forward, or fail forward, or what, however you adopt the fact that you are now at a space and a time in your life where you can experiment with getting in a better fiscal position, right? And so that's many of the things that I think HBCUs could do for the Black community as a whole, right? Because the HBCU community is just a subset representation of the Black community, right? And so if we are able to utilize our schools, right, to utilize the talent, to utilize the actual grounds surrounding the universities, right, to pull the community and the university back to a state of one. When this happens, students end up in a better fiscal position, right? More students graduating in a better mental and financial position means less default on loans. It means more students giving back to the school. It means more students being positive fiscal contributions to the community, right? Like the positive contributions to HBCUs actually caring about the mental ramifications of being fiscally incompetent, has far-reaching ramifications, right? Aside from just teaching students literally, actually how to make money while they're in college, right? And so the most important factor in this feature that I've seen, right? The most important factor regarding your socioeconomic status, even for students, is the company they keep, right? Many solutions are practical, many solutions are literal. Many of them will be technology-based, many of them will be policy-based. For me, I think this starts with day-to-day based, let's say it that way, right? Who are your friends? Who are you talking to on a normal basis, right? I think conversations such as this one serve as the starting point for the solutions, right, to be brought to fruition. Great. So if anyone has any questions, I'll be more than happy to answer those for you.
Thanks a lot, Torrence. Maybe I can help you with the Q&A. We have received some questions from the audience. And one of them actually relates to healthcare and how actually socioeconomic status can affect the health outcomes. So the question is about how can the accessibility and affordability of insurance policies can be improved for African Americans. I think that plays a crucial role.
Right. Well, first, I think part of it is what we're doing, right? Talking about the fact that there is a disparity. And so I think oftentimes what happens is you have a subset of people trying to conjure up a solution for another set of people without talking to those people, right? So the first part is identifying those individuals who feel that, right, that their health, right, whatever state that be, whether that's financial, social, or mental, right, is affected by lack of access, right? I think the first part of that is identification, right? And that would be through the use of technology.
I think identifying the problem plays a huge role. and especially in these socioeconomic things, I think it's pretty important. And I think during the hackathon, this could be a really good topic. So how do you see that, like how can this problem be addressed during a hackathon, like during a 2 days period?
Well, for me, I think whenever you're solving a problem, you always have to start with what's out there, right? And I think a lot of builders and a lot of innovators just aren't aware of the data sets that are out there, right? Basically, every public government agency, every social justice entity, any organization that has compiled data or meets a lot of data in their daily operations, they have made that data accessible, right? Whether via public API or some sort of paywall access, right? If you are a developer or you are an innovator and you are someone who wants to basically weave the fabric of American life into your solution, then you can just use the government's crowdsourced data. I think that would be the first place to start.
And I think some of the questions that we received, like data and identifying the problem is key, but also getting other universities and other people into the game is also key. Like some of the attendees asked the question if there's a way to actually involve people from non-HBCUs and get them to think about these problems.
Sure. So for me, HBCU problems are all people of color problems, right? So my solutions are HBCU born just because those where my resources lie, but these solutions are intended for everyone, right? So if there's any initiatives or anything that I'm doing or anything I'm a part of that anyone thinks they could help with, HBCU student or non-HBCU, the solutions are open to everyone, right? They apply to everyone and they're not exclusive in any way.
I think it's also about like building allies. I think this Hacking Racism hackathon could be a good venue to build allies because you're doing some work on HBCUs, and then this will actually be a bridge between HBCUs and the MIT community, hopefully.
Right.
One of the questions that we received was about the mental health at colleges, especially in HBCUs. What one of the attendees says, although 73% of the respondents said they experienced a mental health crisis in college, only 35% said their health center knew about it. So is there a mental health crisis going on in HBCUs, and is there any like socioeconomic factors affecting this mental health issues?
I would think there's a mental health issue going on everywhere, right? I mean, we've all been in the house for almost a year, right? The life as we know it for the past 10 months hasn't been normal, right? So I think we all, myself included, need to self-assess and say, right, how has this affected me, right? And in what manner am I different? In what manner is my life different? In what manner have my passions been altered, right? And then I think you attach that to a literal aspect, right? Places going out of business and colleges not having enrollment, like these things affect operating budgets, which in turn affects scholarships and people's ability to attain higher education, right? So would I say is there a health crisis at HBCUs? I think the better question would be, is there a health crisis for college students in America, period, right? The higher education system in itself, right, is something that needs to be addressed in regards to. There are, I'm not familiar with the actual apps. I do know of their existence. There are a couple, 3 that I can think of. There are mobile applications that allow you to, if you think that, you are in a different state, right, mentally, physiologically, you are able to reach out to someone with a couple of swipes, right? If I encountered someone that was an HBCU student and I myself wasn't able to talk to them essentially, right, I would recommend that to them, right? They're comfortable with living their lives, right, through clicks and swipes and drop downs. I would recommend they approach that issue the same way, right?
Thanks a lot, Torrence. Actually, like when you talk about like socioeconomic health, one of the things that um, comes to my mind is about like community hospitals. They usually run low on budget, and they're really like they need funding. And COVID actually exacerbated this problem. And one of the questions is related to this problem. So part of it is saying a lot of community hospitals are in jeopardy because of COVID-19, and some of them started closing their doors. What would be the impact on minorities? Why are we overlooking this? And I think this is related to socioeconomic health because the COVID-19 has economic repercussions, as you said, and this is affecting the healthcare system as well.
Right. I think it's going to have a truly negative impact. A lot of the conversations that I had with my friends at the beginning of this was, right, those that are well off are going to be able to weather this storm, right? And I think many of the conversations were, if you're poor right now, you're going to have, it's really bad for you, right? Eating healthy costs, right, in our society. Eating healthy costs. Being in a positive mental state costs, right? Not being able to afford things, not being able to attain education, not being able to progress, not being able to be in an actual physical healthy state, right? You're talking about hospitals, right? Like these things deter away from progression of wealth in my eyes, right? I mean, just literally, it's really hard to think about what your user acquisition costs for your startup, right? If you have a health problem that either lack of resources or lack of income or your generational socioeconomic status has not allowed you to address, right? Those things have a direct impact.
And I think like governments need to play like a key role here. And in the previous session, and also one of the other sessions, we discussed that many of the states are describing the problem, describing racism problem as a public health crisis.
Right.
And during the COVID-19 crisis, we have seen that like some of the states stopped evictions and et cetera to basically give a little bit of relief for people. Do you see that the government or the states should take more action to give more relief to minorities or African Americans so they can actually have access, like much better access to healthcare? And what can be done to basically ensure that they have good access during this COVID crisis, especially because we have seen that like African Americans are more affected by this COVID crisis.
Right. So how could the government help more, or do I think they should help more, basically? That's a tricky question. And I'll just be honest, right? Being someone who hasn't experienced a deep level of economic disparity in my life, always being essentially, if not on the farther inside of progressive opportunities, at least sitting in the middle of them, right? I think that we are all given the same opportunities, but I think it would be, it would not be fair to acknowledge the fact that there are systems that give others a leg up, right? And so if others are given a leg up, right, and it's supposed to be a system of equality, I should get a leg up as well, right? So I guess to answer your question, I would probably say yes. That may have to mean acknowledgement of the fact that there is a disparity in dissemination of services, dissemination of opportunities, healthcare, politics, right? I can rifle off every industry that exists on this planet, and there is a disparity in opportunities, progression, fiscal wealth, ability to pass down to the next generation, and so forth, right? Doing more means, usually if you want to do more to help a subset of people that are supposed to be on equal ground with the other party, right? African Americans and let's say non-African Americans, that means you admit to not playing fair, right? So I think that's a more so a policy related question, right? and less of a technology question, right? The policy just drives the technology that drives the solutions for people, right? So, yeah, I think they could do more, in short.
I think that's it's like once the states identify these problems as a public health crisis, like it's easy to make a declaration, but how you're gonna like solve the problem is another like a set of challenges. And following up on this, Nadia asked, how do you get away from the perception of leftist or centrist principles to discuss increased government intervention, and then as a society accept more government apparatus in healthcare?
Could you repeat that? I'm sorry, not really clear on that question.
So what I understand from this question is that like maybe I should repeat that. How do you get away from the perception of leftist or centrist principles to discuss increased government intervention, and then as a society accept more government apparatus in healthcare?
I think that goes back to what I just said, right? I think at some point you have to realize that, we're all running a lap around the racetrack. We all didn't start at the same line, right? And so that's a little bit deeper political than I want to get, right? I try to stay with technical, actual applicable solutions, right? Policy is not really my wheelhouse. I will say though, I mean, what it sounds like the question is, how do you tell someone to stay out of things yet you keep asking for help, right? I think that's hard. I think you have to find a level of common existence, right? The government needs the people, and the people need the government, right? I think that is what hasn't happened, whether in the last decade or in the last 400 years, right? Is that common ground being found, that common ground of respect, basically.
I think if we give it a little bit of twist on what you said and what our attendees have suggested, like basically if you're rich, you have more chances to get, I don't know, second chances. Like, I don't know, if you can reach hospitals easily. And like, if we actually leave policy aside, other than like, if we just think that the political discussions about these like haven't made any progress, like, do you see any like other ways of building wealth in a minority community so that they can access these second chances?
I think for me, it's about creating streams of wealth in utility, right? What I mean utility, I mean the things people need, right? People will always need to eat. People will always need to groom themselves, and people will always need somewhere to stay, right? Like, and that's just my philosophy, right? And that governs the entities that I own or am a part of, or the streams of income that I try to acquire, right? A lot of what I've seen in the last 10 years is just generationally, you have a set of students, you have a set of parents who were ignorant fiscally. They sent their kids out into the world with no financial knowledge. Now those students are leaving college no more knowledgeable than they were when they entered, but now they owe more money and have no way to generate income, right? Like that perpetually, generationally, that's a hole that just keeps digging itself, right? And so what I think more people can do is talk, right? Be okay with talking to someone who knows more or less than you, because we all have to share. Just more conversation is the very start of fixing things.
I think financial awareness is a key issue, but at the same time, I think there are a lot of like key players in healthcare as well that are exacerbated by these socioeconomic like disparities.
Right.
I think it's good to stop here because we're actually running out of time. Okay. Thanks a lot, Torrence, and I will
thank you.
hand to Angel